Hello and welcome to another edition of Healthy Living on Trust Television. I'm Aisha Salihu. Nigerians in the public, private, formal and informal sectors, as well as those running small and medium businesses, have over time had to pay out of pocket to access healthcare. The effect of these gave birth to the rise of National Health Insurance Scheme, originally modeled to provide healthcare coverage for these group of people, spanning a number of years. However, there has been some complaints in accessing this financial arrangement to cater for healthcare with respect to consultation, diagnosis, medication, surgery, among others, from the insurance policy to implementation and its corresponding relationship with health maintenance organizations, otherwise known as HMOs. On this edition of the program, we'll take a look at the provisions of the new Health Insurance Act and the role of HMOs, with reviews on the idea of health insurance and its link to universal health coverage, as well as the reasons informing the mandatory health insurance scheme. But before we do that, let's hear from Nigerians who work in the public, private sectors or run small and medium businesses who are to benefit from health insurance on the journey so far in attaining universal health coverage through the NHIS.
Health insurance, of course, it covers we have been able to access the medical care through health insurance. But why people have not been educated about the healthcare insurance issue, and even some that are already in health insurance scheme are finding it difficult in the hospital. Finding it difficult in the sense that what is supposed to cover is not covering it, because there are some certain things that they will tell you is not in the constitution or in the law of the health insurance scheme. And the main thing of those things are the things that people cannot afford with this situation of this country. We cannot afford to buy to get them, like MRI, CT scan. If you go there, they will tell you it doesn't cover it. And these are the ones that people cannot afford to access. Because if you go to MRI, they tell you 70, 100,000. Why will you get it? If you ask CT scan, they ask you 50,000. Why will you get it? So the main thing that covers are just mere things, I would say. Paracetamol, anti-malarials, and some little vitamin B, vitamin complex, and so on and so forth. These are the simple things. And these are the ones that the masses can afford. But they are the ones that the health insurance take care of and leaving the major thing that is concerned. So the government should look into this and see the welfare of the people. And the welfare of the people is like you maintain the major thing that concerns the health.
It also be all citizens' rights, but because of the system we have, it's not been achieved. We have a very poor system. So, unlike other countries abroad, it's a program that was open to all citizens. For example, this program, health insurance program, is supposed to be for all nationals of this country, all citizens of this country to enjoy, to have a full health insurance program. Whether you are around or not around, your children, your family, be able to access it without any hitch. But it becomes inaccessible because of the poor system we have in Nigeria, which is as a result of the poor governance we have. That makes it impossible. We have the agency that handles the insurance, but it's not functional. It's not being funded. It's not functional. So it's not meeting the purpose for which it was set up.
If you go to the hospital, whenever you say you are under NHIS, some drugs you tell you they don't have. You go outside and bought it. You go outside, go and buy it. Even when you want to do something, like maybe something that are concerning surgery, they will tell you health insurance is not covered. Which one the health insurance is covered? Why can't you not just bring the list? And we say that these people, they are under health insurance. Where do you insure them? You see some organizations, even some rider, spider, some have an accident, they are not insured them. You go home, go and treat yourself. Where the health insurance is working? The government don't know what we are talking about health insurance. If not so, every little thing, even from 1 to 50, 60 upward, there must be something for them. Free treatment.
I was able to access healthcare through the NHIS, which is National Health Insurance Fund. But the fund is not fully how they are expected to treat us as civil servants. Because if you go to the hospital, there are some bills that say this cannot pass through NHIS. I was on admission due to this accident. There are some bills the hospital say this you have to pay yourself. This cannot go through NHIS. And even right now, going to treat common malaria, there are some drugs they will ask you to go and buy outside with your money. So I feel the introduction of this is to help us and also cushion the effect of us spending money on health. But in a while, the thing is not helping us that much. I can say the help itself is not too broadened. It's something so slim that you'll be on NHIS and you still be spending your money to buy and augment your treatment.
It's almost mandatory. It's not whether we are able to access it. Our ministry, as a federal government staff, you don't need to apply. It is automatic. That shows that the government cares for all the its employees. So automatically, I really enjoyed it. Myself and my family, we enjoyed it up to my last day. Even after I'm out of my service, I continue enjoying it until when it reached the climax, which I have to reapply for another extension, which is ongoing. So health insurance is more or less the only means for people to have an access to health at their own convenient time, at when it is desirable for it. So actually that is good. And I have to believe that it's not only public servants, it's extended to even public, private services. It is a global phenomenon. It is only that it's new in Nigeria right now, but I think if time goes on, it will cover everywhere.
I'm a beneficiary of the scheme. Yes, the scheme is good, but it has its own challenges, and I think it should be a work in progress. The government can still consider it with views like these and others to get the process better off. For instance, when we all know that in Nigeria, the setting we have, most of our children, even at close to age 30, they are still with us, they are still dependents. And you say once they are 18, the scheme does not cover them again. That's one of the shortcomings. Then two, there are some instances we don't go to hospital for even 1 year, 2 years. Nobody prays to be going to the hospital always. But the scheme still goes on and the remittances are made. And when you now have the opportunity to go to the hospital and you expect that you'll be covered in full, they will only tell you this treatment is not covered, this treatment is not covered. And sometimes when you even have referral, because I'm using myself as an instance, I had referral from Federal Medical Center, KEFI, to National Hospital. And the NHIS desk at National Hospital told me that they don't accept referral from other hospitals. The same NHIS scheme, it's very disheartening to hear such a thing. So the system can be improved upon. For instance, the issue of children adding dependents and the issue of discriminating on who is on, because sometimes when you are supposed to be given comprehensive treatment, you are discriminated against in some hospitals that no, this one does not cover. Even in some hospitals, the doctors that sees people on NHIS scheme is different from the doctors that see other patients. Why? It's not proper. I think the system can be improved upon. It's a good scheme that should not be abolished, but improved upon.
The National Health Insurance Authority Act was enacted in 2021 to repeal the National Health Insurance Scheme Act to ensure the effective implementation of the National Health Insurance Policy that would facilitate the attainment of universal health coverage in Nigeria. With all the shortcomings of the NHIS, the Executive Secretary and Chief Executive Officer, National Health Insurance Authority, Professor Mohammed Nasir Sambo, in an exclusive interview says about 16 million people, which accounts for below 10% of the population, are covered at the moment. However, restructuring of the NHIA is one of the measures towards ensuring more coverage for people.
Yeah, the current penetration of health insurance as at today, when you look at the aggregates, you can project it to about 16 million people. So it's still hovering below 10%. A lot has been done in terms of trying to expand the fiscal space to ensure that everybody is on board into the National Health Insurance Scheme. You are aware of the crisis that enmeshed the organization in years back until 2019, when after the presidential panel of inquiry that led to taking some bold steps in trying to rejig the organization. We came as a product of that presidential panel report. And when we came, we x-rayed the ecosystem, and we realized that there are so many problems. And apart from x-raying the situation, the report of the presidential panel has underscored a lot of problems about 10 key problematic areas that we were given to quickly address. So our first year was dedicated to ensure that we brought in stability into the organization. We embark on what we call rebranding agenda of the organization, which was anchored on 3 pillars. One, restoring value system that will make the organization credible and result-oriented. Second, engendering transparency and accountability in the entire operation of the organization. And third, to accelerate the drive towards attainment of universal health coverage. We felt that rebranding effort is very, very key to, one, be able to stabilize the organization, number 2, to be able to reform the organization, and number 3, to refocus the organization for better performance. And we went straight into deconstructing the pillars into various elements. Like if you look at the element, the first pillar has about 3 elements that has to do with creating a very good and working enabling environment, ensuring discipline within the organization, and creating mutual respect and harmony, and ensuring that equity is engendered in the process of managing the organization. And we step in to implement all those elements that we have identified as key for stabilizing the organization. That is why this organization that has been notorious in terms of crisis has now been fully transformed. You don't hear any crisis within the organization. Neither do you hear any heard of any crisis outside the organization. So with respect to the transparency and accountability, we have worked very closely with all the stakeholders in the health insurance ecosystem, and we have consistently embarked on process of informing, educating, and enlightening people so that they know what the health insurance is all about, what is their roles and responsibility, and so on and so forth. We have also recognized the fact that for us to have an overarching transparency system, we need to digitalize the system so that whatever is being done in the organization, in the entire ecosystem, can be driven digitally. As a chief executive officer, you can be here, you monitor all that is going in terms of service provision, in terms of finances, and so on and so forth. So we have done all that. Then in expanding the fiscal space, we have pursued it in two-pronged approach, which is in line with the third pillar of the rebranding. One, we try to consolidate the existing programs that are there, programs for the formal sector, programs for the employees of the formal sector, and employees of the federal sector. There were a lot of bottlenecks in the implementation of these programs, so we tried to look at those bottlenecks with a view to finding how to resolve them. And we have gone far in trying to address most of the key critical issues that are affecting the smooth operation of that system. Then on the second perspective is the issue that has to do with innovation. We have created a lot of innovations that is aimed to expanding the fiscal space. One of the things that we have done, even though we made it on ground but not being implemented, is the issue of basic healthcare provision fund. This is a system. This is a creation of the National Health Act, this Basic Healthcare Provision Fund, creation of the National Health Act that has given healthcare delivery system opportunity to have 1% of its consolidated revenue, and out of which about 50% is coming to the National Health Insurance Authority, and we in turn distribute it to the states. Because states have their state health insurance agencies so that they can cover the vulnerable segment of the population. By vulnerable, we are talking about the poor, the women with reproductive age, and the children under 5, people with disability, and other people that are in disadvantageous positions. So this is what the basic healthcare provision is aimed to achieve. And if you go to almost all the states apart from Rivers and Akwa Ibom, you realize that a lot of vulnerable people are benefiting already from the program. Number 2, we have also created what we call Group, Individual and Family Social Health Insurance Program, GIFSHIP. About 1.5 years ago, Honorable Minister of Health launched that program. That program is intended to bring the informal sector. If you look at the informal sector segment of the population, I mean those people that are self-employed, those people that are working in an organization that has less than 5 workers, they constitute majority, the bulk of the population. If you look at the health insurance before we came in, there is no significant provision to bring about those group of Nigerians. So with GIFSHIP, people can now, irrespective of your work status, whether you are an individual or you are a group or you are a family or you are a group that is binded by one sum of cohesion or the other, you can come into the National Health Insurance system. But the most important issue that we have done in expanding the fiscal space is to ensure that we have changed the law establishing the National Health Insurance scheme to what we now have as National Health Insurance Authority. The most important aspect of that law is that it makes a provision of what we call vulnerable group funds. And these vulnerable group funds, it is intended to take responsibility of about 83 million poor Nigerians that have no financial access to the healthcare system. So with the signing of this law, health insurance is now made mandatory, irrespective of where you are, and you have ability to pay. You must come to the National Health Insurance System. If you are not gainfully employed to the extent that you can pay for the health insurance services, we are by this vulnerable group fund, you will have opportunity to be covered. And for us to be able to achieve that, we need to develop an operational guidelines, and we also need to have a very robust conversation on the issue of innovative financing that can bring about a lot of resources into the healthcare, which we are already working on them.
Section 1 of the NHIA establishes the NHIA, while Section 3 provides for its functions to include, but not limited to, promote, integrate and regulate all health insurance schemes that operate in Nigeria, ensure that health insurance is mandatory for every Nigerian and legal resident, and enforce the basic minimum package of health services for all Nigerians across all health insurance schemes operating within the country, including federal, states and the FCT, as well as private health insurance schemes. We'll get more details after the break. Do stay with us. Welcome back. If you're just joining in, this is Healthy Living on Trust Television, and we have been discussing the National Health Insurance Act. Against the background of the foregoing, there are a plethora of reasons in support of compulsory and universal health insurance schemes in Nigeria. They are to achieve universal health coverage, financial risk protection in accessing healthcare, introduce equity in financing healthcare, and facilitate the implementation of the minimum core obligation of the state on the right to health. Others are to reduce the financial burden on the government, guarantee sustainability and credibility of health financing, facilitate the whole of society approach to health, and set the building block for a vibrant and healthy population. Furthermore, health insurance is a means of poverty eradication, reduces inequality, and uplifts the low strata of society. However, despite the mandatory nature of the scheme, there will be citizens who, due to their special financial and physical circumstances, may not be able to afford the premium to make them eligible to be covered by health insurance scheme. This is where the core obligation of the state on the right to the highest attainable state of physical and mental health kicks in to ensure that special equity funds as established under the law will fill the gap. This ensures that such persons access to, at the very minimum, the minimum package of care provided in the National Health Act. According to the Executive Secretary and Chief Executive Officer, National Health Insurance Authority, Professor Mohammed Nasir Sambo, effective implementation of the provisions of the NHIA will cater for all the loopholes.
There is what is called health insurance for social health insurance. Social health insurance is a solidarity arrangement that is aimed to primarily cater for those who cannot have access to health care. And that's what the government health insurance system is aimed to drive. On the second part, there is what is called private health insurance. Private health insurance is an insurance system that people that have access to financial access can go and get it. So what the new law is saying is that let us have a very clear demarcation. You drive a social health insurance with little or no participation of HMOs. Then you have a private health insurance which HMOs will drive. So by the time we start implementing this law, package, you will realize that a lot of things will change with respect to the operation. Because the health insurance is intending to provide what is called minimum healthcare package. And by minimum healthcare package, it's a package that every Nigerian should have access to, irrespective of his socio-economic status. And under this new law, this will be driven solely by the National Health Insurance Authority and state health insurance agencies. So those bottlenecks that is very recurring with respect to the interface with HMOs will no longer exist. However, HMO will be allowed to do other things. Number one, HMO will drive what is called supplementary health insurance. Any insurance beyond the minimum care package can be driven by health maintenance organization. HMOs can also drive what is called private health insurance, as I explained. Then in the law, there is a provision of what is called third-party administration, TPS. HMO can act as a third-party administration. Third-party administration are private-oriented organizations that can come and work with health insurance either at national level or at state level to be able to take care of some aspect. For example, a state wants to do a call center management, call center system, whereby a release of health insurance will call and find out for inquiry or to lodge their complaint. The state might say, we don't have core competence or we don't have structure to do that. The third-party administrator can be able to assist the state or to assist on any other issue like financial management system and so on and so forth. So the rumor going around that we are trying to throw away HMO is not entirely true. We are redefining the functions for the betterment of everybody in Nigeria.
Nigeria now has a well-structured federal law on health insurance, which is complemented by various state-level laws. These subnational laws also provided for compulsory and universal health insurance. What is now outstanding is the political will at the highest levels, expertise and capacity of the various executive and implementing agencies across the Federation to ensure that the new regime of compulsory health insurance translates to improvement in universal health coverage. We'll draw the curtains at this juncture on this edition of the program. Do well to follow us across all social media platforms for comments, suggestions, and contributions. I'm Aisha Salihu. Thanks for watching.